All right, so 17.2 is over, and everyone's back still hurts from 17.1. So something to take into consideration over the next few days as you're mobilizing your lower back and hamstrings. In particular, when stretching the hamstrings, and regardless of how you're doing the hamstrings, whether or not you're throwing your leg up onto a bench, you're laying on your back and you have a band and you're just raising that leg up to stretch those hamstrings. Kind of what we go over, the principles can be applied to however you decide to stretch your hamstrings. So we're just going to use a bench here for the example. So when throwing your leg up onto a bench and attempting to stretch your hamstrings, what tends to happen with a lot of athletes, what you'll find is as you're leaning forward to try to stretch or mobilize those hammies, you're feeling it primarily in the back of the kneecap. If you're feeling a stretch when you're attempting to stretch your hamstrings in the back of the kneecap, you're not even stretching your hamstrings. Most likely you're stretching a branch of your sciatic nerve, it's your tibial nerve, and actually by stretching that, you're going to make the lower back and hamstrings worse. So simply by modifying it and just bending the knee a little, so if you just bend the knee enough so you feel the stretch from somewhere above the hamstrings up to the top of the glute, and then from there, leaning forward, leading with your chest, you should feel it actually in the back of the hamstrings, so you're stretching them. And then from there, you can choose to do dynamic stretching, you can hold it statically, really it's up to you. I just don't want anyone making their backs any worse than they already are. Hopefully this was helpful, guys.